Good morning. My name is Rich and I'm here with an organization called Hearth Connection. We are a statewide network of supportive housing programs across the state of Minnesota, and our goal is to actually break the cycle of long-term homelessness. We focus on individuals that experience long histories of homelessness. One of the things that's complicated about the homeless social crisis is that when you look at all of homelessness as an arc, there are many people involved in that arc. There are veterans and families with children and single adults and youth and lots of different categories. But when you look at the entire arc, people that experience homelessness, the vast majority actually only experience short-term crisis. They become homeless for short periods of time and then they get reconstituted back into housing. But what we figured out over a decade ago is that there was this segment of the homeless population that kept cycling through homelessness. And they weren't just cycling through our shelter programs, but they were also cycling through other very costly crisis services. So we kept seeing them in emergency rooms, in inpatient treatment, in chronic health clinics, in urgent care, in detox, and in jails. These people were cycling through multiple systems, and no one was addressing the kind of root causes of their homelessness. Hearth Connection in 1999 got founded because a bunch of people came together and said, gee, we think we can do this a little bit better if we really targeted and focused our resources together on this population that's cycling through long-term homelessness. And so we began as a research pilot to try to prove something that some people believed at the time, which is that some people were beyond help. That there was just people that were experiencing homelessness and there was nothing we could do for them or with them. And we thought that that was wrong. And so we started to engage them with really intensive case management services, building trusting relationships with them, and hooking them up quickly with resources and housing. We researched that model of services for several years, and what we proved was that when we took people that had long histories of homelessness, people that had been on the streets for years, I'm talking like for 3, 4, 5 years, sleeping outside in shelter programs for long periods of time, within 3 months, we had them housed because of our intensive services. And once we got them housed, we were able to retain housing for a year or two. So our outcomes began to show results. And because of that, the state of Minnesota instituted a business plan to end long-term homelessness in 2003. So the Governor Pawlenty, and the legislature at that time, through a bipartisan effort, established this plan to actually address long-term homelessness, and they constituted a state funding pool called the Long-Term Homeless Supportive Services Fund. We just call it the service money. And the service money actually goes to create these collaboratives around the state. So we went around the state and we formed these regional collaboratives that set up mobile teams of caseworkers to go out and engage people in the community where they're sleeping, whether it be outside, in a shelter, in a car. And we actually engage them around breaking down barriers not only in the nonprofit system, but in the county system as well. And so Hearth Connection became the administrator to help these regional collaboratives do their work over time. And for the last 7 or 8 years, we've been doing that. We've been administering these regional collaboratives north and around Duluth, down in southern Minnesota, and here in the metropolitan area. We serve about 1,300 people a year, and we've had great success in keeping people housed and connecting them with their families and in achieving better health outcomes. What I want to tell you about the Long-Term Services Fund is that it is currently up for funding at the legislature. And it is also complicated because we've been running with about $13 million for the last 7 years in that pot of money. But it's now been cut back a little bit to about $10 million, $9.8 million in both the House and Senate appropriation bills. It's hovering around 10. So we're looking at about a 20% reduction. That will have serious consequences for our program and the people that we work with in the community because we run on a long-term housing model. We're not transitional, we're not shelter. We get people housed and we help them maintain their housing through these subsidies and services. And without these services, we'll not be able to maintain people in the same level of intensity. So I'm here to say today that if you have a chance to talk with your elected officials, I hope you'll take the opportunity to talk about the importance. Laura's group has been talking about these business plans to end long-term homelessness. The last thing I want to end with today is just to tell you that I think one of the myths out there with homelessness is that we simply don't know what to do about this social crisis, that there will always be homeless people with us, and that we simply don't know what we're doing. And what I want to reassure you is that for the last decade, my program and others have been documenting our work, showing a return on investment, that when you invest money into these people, there is a return on health, a return on housing stability, and we're able to actually end homelessness and the cycle of homelessness. So even in places when we're in a large economic recession and crisis, we should be investing in programs and in agencies that show a return on investment and show progress. I hope that we'll continue to support these plans and support the services that underlie them. And I really appreciate you getting up so early on a Saturday morning and listening to us, so thank you.